Makes you wonder if a tornado touched down here in West Michigan. Area hospitals, they need to be ready to treat hundreds, if not thousands of injuries. But what would happen if the hospital itself were damaged? 24-Hour News 8's Mark Thompson spoke with Spectrum Health officials about that very emergency plan. Mark?
Well, Brian, each year Spectrum Health trains for scenarios like this. In fact, they just conducted a drill earlier this month. It's a coordinated effort between all levels of government as well as EMS and other hospitals. If a tornado were to touch down in Kent County, patients would be treated according to the severity of their injuries. The most critically injured sent to the hospital designated with the highest level of trauma care. That would be Spectrum Butterworth, a level 1 trauma center, followed by St. Mary's at level 2 and Metro at level 3.
Those levels of patients would be identified at the scene and they would be appropriately transferred to those facilities based on that EMS protocol.
If Butterworth itself takes a direct hit, the hospital would assess the damage to see what areas are still functional, set up a command center, and begin to treat patients on site as much as possible.
So if we still have ICUs that are standing, we're going to leave our patients there.
If the hospital is unusable, then a regional plan kicks in to transfer patients to other hospitals. Grand Rapids is in Region 6. There are 13 counties in the region with 22 acute care facilities. Regional Command in Muskegon would send out a bed count, and EMS would respond to Butterworth.
Would be able to then deploy and transfer patients to an appropriate location.
The hospital can also set up in a temporary site. For Butterworth, that's the Cook Health Sciences building. However, Cook is just 2 blocks away, so it's quite possible it too may have been damaged in the tornado's path. But if usable, Spectrum could admit up to 250 patients pending state approval.
But with this facility, because they're already set up as a healthcare education environment, they have some capability that we would be able to utilize in an event like that.
And of course, as a last case scenario, hospitals can use wide open spaces like a gymnasium to treat patients, but of course there they would only be able to provide the very basic level of care for those patients. Reporting live in Grand Rapids tonight, Mark Thompson, 24-Hour News 8.